Hello all, welcome to Care Samvaad with me, Mirchi Hemant. Today I have Dr. Akash Chaudhary. Hello doctor, firstly welcome to the show.
Thank you so much.
So we're very excited because a lot of issues that we're going to talk about are the ones that are always discussed on social media.
Social media, absolutely.
So let's start off.
Yeah.
So first word is GERD, G-E-R-D, GERD. This is a word that's been making a lot of noise on the social media, on digital platforms everywhere. What is this, sir?
Actually, GERD is nothing but it is gastroesophageal reflux disease.
Right.
What happens is that the acidic contents of the stomach, they come into the food pipe and they cause all the symptoms. Like people say burning in the chest called heartburn, then they can have cough, they can have vomiting, and they can have pain in the upper abdomen.
Does this, the reason to have GERD is the same lifestyle issues like your diet, your sleep, and the other factors?
Yeah, definitely. Diet, your sleep, smoking, alcohol, these are all the risk factors for having GERD.
And when they say you have a heartburn, when someone has a heartburn, so when is the time when we have to see a gastroenterologist, and when is the time we can say, "Okay, I can handle this type"?
See, if you're having once in a while, everybody has reflux disease, reflux symptoms once in a while in their lifetime, or once a month, it's okay. But if it's troubling you and you're having regular pain or you're vomiting, so there are some red flag signs which you have. Like if you're vomiting, severe pain before and after every meal, and you're having difficulty in swallowing, or you're having some blood vomiting, that is time you must see a gastroenterologist.
And a lot of people who buy, say, the antacids over the counter, antacid tablets, they are advertised heavily on TVs and etc.
Yes.
Is it safe to go that way?
See, once in a while, if you're taking a PPI, or if you like, suppose GERD is, we do an endoscopy and we find out that you are having reflux-related problem, then we put the patients for treatment.
Right.
And we treat for bacteria called as H. pylori in the stomach as well. So that can all be part of increased acid secretion. So
Right.
we treat them for 4 to 8 weeks. And then basic is lifestyle modification and your dietary habits. That is the most important.
Sir, every time you say lifestyle problems, then it totally reflects on the entire generation, because a lot of people you see are having the issue, right? So when you see people having bad lifestyles or bloated tummies or something, do you feel like saying something to them?
See, it's such a social taboo. We cannot tell anybody anything about the obesity and all that. But we definitely tell them, modify your lifestyle, do regular exercises, eat healthy, sleep. Sleep is very important.
Right.
You should sleep 6 to 8 hours.
Yes.
So all these things we advise them.
Doctor, jaundice, for that matter, jaundice is also very, very misunderstood all the time, I think. Can you please walk us through the different kinds and how you treat them, or what are the red flags in the jaundice? Please tell us.
See, jaundice, again, it is the yellowish discoloration of your white of the eyes, right? Call this sclera, and sometimes the skin and the mucous membranes. The jaundice is divided into 3 types. It can be prehepatic, it can be in the liver, hepatic, and can be outside the liver, that is post-hepatic. So like if somebody has a hemolytic jaundice, where the RBCs are breaking more and the liver is not able to filter that much, they develop hemolytic jaundice, which can lead to stone formation, gallstones and CBD stone formation. Then you have intrahepatic, that is in the liver, which is common causes are your hepatitis, all A, B, C, E. Then you have alcohol, autoimmune hepatitis. So that is in the drugs. Some drugs are there, like anti-tubercular drugs, some steroids. They can lead to hepatitis, jaundice, right? So we have to treat them. And then the third is post-hepatic, that is outside the liver, which can be due to some malignancies of the pancreas, cancers of the pancreas, or cancer of the common bile duct through which the bile flows into the small intestine, and it can be due to stone disease. So all have separate treatment.
And when you say jaundice, doctor, my question is, how does one differentiate between, say, a harmless jaundice and a serious liver disease?
See, serious liver disease means the patient, jaundice, as I told you, jaundice presentation can be different. So if you have history of alcohol and all that, you develop alcoholic hepatitis, in which there is treatment, right? But alcoholic hepatitis, recurrent hepatitis can lead to liver failure.
Okay.
Then it becomes an emergency, right?
Okay.
Then sometimes patients with severe alcoholic hepatitis, they do not recover. So we have to use some other medication like steroids sometimes for them. Then if it is jaundice due to obstruction in the common bile duct, then we do a procedure called as ERCP, and we try to remove that stone. Their presentation will be severe pain, fever, vomiting, and jaundice will be high. So we do a procedure ERCP and we try to remove the stone if there is a stone. If there is a malignancy, we try to put a stent or take a biopsy, and that is how we go ahead.
And also, doctor, now from liver, let's move on to pancreas, which is also very, very important in a human body.
Yes, most important.
And when they say pancreatitis,
Pancreatitis, yeah.
so how do you differentiate between the acute ones and the chronic ones?
See, pancreatitis, as you said, two types, acute and chronic. Acute is that patient will have swelling of the pancreas, and once we give rest to the pancreas, we give them some painkillers, they give them some IV fluids, they settle down. Mostly 3 to 4 weeks it takes, but they settle down. But if there is recurrent pancreatitis and some genetic causes, then they can go to chronic pancreatitis, which is irreversible. You develop some calcification, that is stones in the pancreas size becomes small. That is chronic, that is irreversible. That is chronic pancreatitis.
And is alcohol the reason?
Alcohol, yes. Alcohol is the reason for both acute and recurrent alcoholic pancreatitis can lead to chronicity.
So my question is, how is this managed, doctor? I mean, so that it doesn't become a life-threatening issue?
See, first thing is that most important is that when are you presenting, right? Because there is a lot of third space loss during acute pancreatitis. So we have to give them good hydration, ICU setup, painkillers, and then we have to see that basic thing is to give rest to the pancreas. So sometimes we put an nasojejunal tube so that the pancreas don't contract, and we keep the patient nil by mouth. Sometimes if there is some infection and all, then we put them on antibiotics as well.
Oh, and also, will there be any long-term complications, doctor?
See, long-term complication means for acute pancreatitis, you can, if it's a mild pancreatitis, not a very severe pancreatitis, then they settle down. But if it's a severe necrotizing pancreatitis, then what will happen is that they can develop some complications, like they can develop pseudocyst formation, and they can develop walled-off pancreatic necrosis, and severe pancreatitis, they can develop renal failure, that is acute kidney injury can be there, or they can develop ARDS, which involves the lungs. So it can be pretty bad.
And also, doctor, I keep hearing this word called GI bleeding.
GI bleed, yeah.
Is it a very serious thing? I mean,
yeah, it can be serious. GI bleeds can be fatal. Like depends. Like again, GI bleed is divided as upper GI and lower GI.
Right.
So upper GI is basically up to the third part of the duodenum. There's a ligament of Treats. Anything above that is taken as upper GI, and below that we take it as lower GI bleed. So upper GI presentation is mostly they present with blood vomiting, fresh blood vomiting, and sometimes they can be black motions. They can have black motions, that is called melena. So these are the presentations of upper GI bleed.
Right.
And lower GI bleed can present as frank bleeding per rectum, or sometimes they can be painless bleed, or sometimes if there is a malignancy on the right side of the colon, they can present with black stools as well.
Oh. So I'll tell you one story, doctor. So I saw this advertisement of one organic cleaning, organic...
colon cleaning,
organic ashram type. Okay, where they said what they'll do is they'll wake you up in the morning, give you a warm buttermilk, and then you'll have to drink an entire bottle, then vomit it out. Okay, they put your fingers and vomit it out, and then they'll ask you to do some yoga, something. Then they'll lay you down on your back. They take something warm and rub it on your tummy so well that you start your motion come in black, and they call it cleansing of the toxins. Is this true?
I really have not much of idea about this, but
so my question is motions in black color is a good
black
sign?
motion? See, black motion you can have if you're on iron preparation,
right?
Otherwise, black motion is not taken as very good. So whenever a patient comes to us, we ask them, are you on any iron preparation? If no, then we see to it that we scope them and see,
right?
Because we can find so many things.
So the next time you see an ad, be careful. Doctor, the most common issue for a lot of people in the 30s right now is constipation. Right? People think constipation is a joke, they don't say it out like that. But I'm sure it is much beyond that. Is it very serious?
The definition of constipation abroad and in India is totally different, right? Basically, if you're having 3 to 4 bowel movements per week, that is okay, right? But again, the constipation is also divided as normal transit or slow transit, right? So normal transit is that you are having motions, but you are having some bloating and some discomfort with it. But you are having stools daily, you are passing motions daily. Other thing is that the slow transit constipation. In slow transit constipation is that the motion is not moving forward very soon, right? As a daily, people do not go to washroom daily. So that is a slow transit constipation. And then sometimes what happens, there are muscles like pelvic floor muscles which support the rectum. So if those muscles are weak or damaged, then also you can have constipation.
And a lot of people also take laxatives, right? Is that safe?
See, again, depending, it's always better to include your diet with roughage, have more liquids. But laxatives once in a while are okay. But if you are having slow transit, then we give them stimulant laxatives for the motility to increase and pass motions. And in cases of pelvic floor, as I told them, then you have some biofeedback therapies which will help them and target how to improve their muscles.
Doctor, the dangerous word that we keep listening is called colon cancer. What leads to colon cancer?
See, basically you have to have a family history of colon cancer, but otherwise a lot of people develop polyps in the colon. Polyps are some extra growths in the colon, which can lead to cancers, which can lead to malignancies. So normally whenever we do a colonoscopy and we find a polyp, we try to remove it. Right. Or if not, we try to take a biopsy to see what it comes out.
Right. Doctor, they say mental health, physical health, emotional health, brain health also. How important is gut health?
See, gut health is very important, and as you said, brain-gut, there is an axis, there is a brain-gut axis, right? The brain is connected to the gut, and they keep on talking to each other, right? So any problem in the brain, it sends a signal to the gut, and there are a lot of diseases because of brain-gut axis. You see, there is irritable bowel syndrome, which can be diarrhea predominant or constipation predominant. Then you have functional bowel disease, that if you do an endoscopy, you do a colonoscopy, and you do a CT scan, there is no abnormality. But it is again the brain-gut axis. That is the functional bowel disease. What happens is the hypersensitivity of the gut increases. So you are intolerant to the smallest stimulant. So that increases the pain.
So in your case, what should one do to take care of their gut health?
See, eat healthy, as I said, exercise regularly, lot of veggies, lot of fluid in the diet, right? And sleep well. And if you are stressed, you can always meet a doctor and get some antidepressants, because it's all interrelated.
Yeah. And in the long run, if one wants to take care of that long-term digestive issues that never should it pop out, what should we do?
It's very difficult. As I told you, it's very difficult. Some day or the other, sometime or the other, everybody goes through all these features. Like since childhood, we are saying exam time, we have to go to the washroom. Going to a party, you have to go to the washroom. That's all brain-gut axis. That is all irritable bowel syndrome.
When you get scared, you feel like go peeing.
Yeah, that's exactly what the system is. But only thing is, as I told you, eating healthy, sleeping well, exercising, doing some meditation does help.
Wow. Like I said, doctor, I have so many things to ask you. Just keep on going, I guess. However, because of the time constraint, the next round that we have is called the rapid care questions. All right?
You just want me to say yes or no?
Maybe in a word or line.
In a word or so.
Okay, let's go, doctor. Perfect. Coffee on an empty stomach, yes or no?
Not for everybody. I don't suggest, because it can cause more acidity.
Is intermittent fasting good for gut health?
Again, not for everybody, but yes, it does help.
Home remedies for acidity, helpful or harmful?
Home remedies, if taken in proper quantity, should be good, like cold milk, buttermilk, or you can have fennel seeds. They are good, can be taken.
One food you should never eat for gut reasons.
See, one food, very difficult to say, but I still feel that avoid carbonated drinks.
Okay. Very hard when you.
I know, that's why.
When you watch a movie.
I said very difficult. Yeah.
Can gut health impact mental health?
Yes, it can.
It can.
Yes.
Thoughts on probiotic supplements, like, are they useful or they're just marketing gimmick?
Gut microbes are very good. Pre and pro, both biotics are very good and can be taken.
Is bloating after meals normal?
Mild bloating after meals, which does not cause any discomfort, it does not cause pain, and subsides within a few minutes or few hours is okay. But if it persists and causes pain, vomiting, or any other features, then it has to be taken care of.
One lifestyle habit that transformed your own health.
Intermittent fasting and regular exercise.
Thoughts on colon cleanses or detox teas?
See, colon cleansing, basically we clean colon when we want to do a colonoscopy. So we give polyethylene glycol, so that cleans it, so that our vision is clear. And the teas, detox teas, they basically, what I understand, I've never tried them, but what I understand is that they contain some laxatives.
Okay.
So once in a while it's okay, but I don't suggest.
Okay. And finally, taking the phones to the bathroom.
No, I don't recommend.
Newspaper?
No.
Book?
No. Because when you take all these things, you sit on the seat for a longer time, which doesn't help your gut.
What is the average time one should sit?
Very difficult question to answer. I think 5 minutes.
5 minutes. 5 minutes. Stopwatch on and then go to the bathroom. Thank you so much, doctor.
You're welcome.
Thank you so much. We had a nice time, doctor.
Pleasure.